Association of Parental and Enteral Nutrition, iapen, Hyderabad chapter, and St. Anne's College for Women, Hyderabad. It gives me immense pleasure to extend a very warm welcome to our dignitary speakers, esteemed guests, faculty members, and participants on behalf of Department of Nutrition at St. Anne's College for Women and iapen Hyderabad chapter. I deem it a privilege to welcome Dr. Damodar, Honorary Vice Chancellor, and Dr. Purushottam Reddy, Honorary Chancellor of Chaitanya Deemed University of Warangal to this webinar. We are awaiting their presence. We shall start today's webinar by lighting the lamp as a significance to bow down to knowledge as the greatest of all forms of wealth. I request the support team to present the slide of lamp lighting. Thank you, Sanjana. It's a tradition followed at St. Anne's to welcome the dignitaries with a green greeting, which signifies the Janaki to accept the green greetings. Sanjana, green greetings, please. This time it is virtual, sir.
Thank you.
Thank you.
Thank you. Thank you all.
Oh. Pleasure, sir.
It's a tradition, as Fanny said, in our college. Instead of bouquets, we present our guests with a plant, so that, as we said, it signifies the growth of our future growth of our relationship.
Moving forward, ma'am. iapen is an organization in the field of parental and enteral nutrition with an aim to improve nutritional care of people at risk of malnutrition, besides promoting basic research, clinical research, advanced education, organization of consensus statements about clinical care and quality control. Hyderabad chapter of iapen was launched on 29 September 2020. These are a few pics of iapen.
Sanjana?
Next slide, yes. So as is told, iapen is collaborated with various pen organizations all over world. It is recognized by ESPen, ASPEN, BAPen, and all sister pen organizations. The founding members, distinguished founder members, and current officers, Honorary President, Honorary Vice President, Dr. Ashwin Dabi, who is there with us now.
Okay.
Nutrition department at St. Anne's has been constantly conducting several activities to impart knowledge to students even during the pandemic. Today's webinar is a collaborative effort of iapen and St. Anne's Nutrition Department to gain insights on post-COVID illnesses in diabetes. I now request Organizing Secretary of the webinar, Dr. Meena Patange, Vice President iapen Hyderabad Chapter and Head Department of Nutrition and Dean Administration, St. Anne's College, to give the welcome address. Before that, a few lines about ma'am. Ma'am has got a vast 32 years of teaching experience and has been a member BOS OU and other autonomous colleges, has undertaken several projects and developed modules of video lessons for UGC. Ma'am has served as Vice President of IDA AP chapter, has many publications, international and national, to her credit. Ma'am has also received many awards, noteworthy being the Telangana Best Teacher Award conferred by Government of Telangana in the year 2018. Ma'am, over to you now.
Thank you so much, Fanny. That really wasn't needed, my introduction. I'm an office bearer of IAPN, but nevertheless, thank you so much. Good afternoon and welcome to all the dignitaries, the executive committee members of IAPN, and all the participants, students especially, to today's national level collaborative webinar on post-COVID illnesses in diabetes as part of the World Diabetes Day activity. St. Anne's College, the co-host for today's webinar, is a 37 years young educational institution catering to the higher education needs of the young woman. The institution is autonomous and affiliated to Usmania University, and it is NAC accredited with A+ grade in its third cycle too. The Department of Nutrition at St. Anne's was established 32 years ago and has experienced faculty who, apart from teaching, are involved in research and community outreach activities. The department alumni is well placed far and wide in all areas of nutrition and dietetics. The identification of novel coronavirus SARS-CoV-2 in December 2019 has led to a growing and continually evolving body of knowledge about the virus and the disease it causes, that is COVID-19. In peer-reviewed literature and in public discussions and the media, persistent symptoms are being reported among COVID-19 survivors, including individuals who initially experience a mild acute illness. These persistent symptoms pose new challenges to patients, healthcare providers, and public health practitioners. The natural history of SARS-CoV-2 infection and COVID-19 is new and an area of current investigation. The prevalence, type, duration, and the severity of persistent symptoms following resolution of acute COVID-19 infection, as well as the risk factors associated with the development of these post-COVID illnesses, are currently being studied, all the more in population which is suffering from diabetes. Hence, we thought it was highly appropriate to invite the specialist in the relevant regard. This webinar is a humble beginning of IAPN and Hyderabad chapter in collaboration with St. Anne's College to bring scientists and experts in the field to share their valuable knowledge and information with IAPN members, academicians, practicing dietitians, and students. So, my dear students who are all here, we welcome you to join IAPN as members, because not only do you learn in terms of knowledge by participating in various programs, but it has several academic programs which help in increasing your skill sets and adds to your knowledge base. So most welcome. Now, it's an honor to introduce Mr. Kunja Bihari sir, the president of IAPN, to take over as to give his presidential address. But before that, a few words about sir. Sir, it's in fact, he's a very eminent personality in the area of clinical nutrition and dietetics in the Telangana region. He's a managing director at Holistic Nutritional Services, Warangal. He's working as a dietitian for the last 20 years in the government sector. He took retirement few years back. He has established departments of dietetics in 7 medical college general hospitals and participated in medical nutrition therapies and conducted education to the medical and paramedical professionals. Over to you, sir. We are waiting to listen to you.
Hello, good evening.
Yes, sir.
Yeah, good evening, everybody. It is a privilege and hello. Are you
Yes,
listening?
sir. We can. Yes, sir. We are able to listen. Good evening.
So, good evening, everybody. And it is a pleasure of coming back to you as a practitioner dietitian. So, I was not an academician. I was been working with the medical colleges for the last 35 years. Got treated in 2012. Being a dietitian, I oftenly feel that we need to propagate nutritional management system not only to the hospital people, hospital patients, and to all the public in respect of shielding themselves from the infections. We need to enlighten the public in respect of nutritional sciences, educate them in respect of nutrition, and encourage them to practice the nutritional service, nutritional requirements of the body to improve the immunity levels. That's what I call often the EQ. Enlighten, educate, and encourage the people to practice nutritional services, thereby improvising the immunity levels of the public. Some disturbance is there. Can I please?
All of you, please kindly mute your microphones.
By EQ method, what I say is enlighten, educate, and encourage the people in the nutritional management services, whereby shielding infection by way of immunity to the public. Halfly, we have been all the time saying that we are disease-oriented care. After getting disease, we try to put our care into them and see that they get rid of the infection. Unless until we put some extra services to healthcare in respect of nutritional management in the public, it is going to be give more immunity levels to the public. So it itself gives a shield to the infections. Actually, the all these years, the pandemics are being there with us, like of influenza, SARS, Spanish flu, and coronavirus. All of them are making us to find fault with the public health programs where we are not able to put the show of preventive measures of the infections. Not only these three, lot number of disease conditions were being not been properly been treated with the patients, treated with the public health care system, whereby losing lot of health of the public. This first point is that in the primary health level centers where we need to encourage nutritional education in the form of creating an awareness to the public whereby they can improve the immunity, which has been not done in India or anywhere almost in the world. I think so. This was the lacking. We almost all of the treatment goes with the disease care rather than healthcare, which needs attention at personal levels. We have seen in the hospitals, the poverty-laden people are undernourished with lot of infections, a lot of infections, and lot of malnutritional statuses. We admit in the patients and treat them with the nutritional services. They get rid of it. But before that, we have to enforce the nutritional requirement of the public in a systematic way into the public health levels by primary health centers. We could able to deliver a good health to the nation. So the third is almost all of us, we more concentrate on care of the disease, not care of the public health system. Was my personal view. But being I was been working with the field also, I noticed that personal hygiene and nutritional levels were so poor. The concurrent infections for the public is most of the time the nutrition and personal. In this regard, I request all of our nutrition professionals to enlighten the public and educate the public and encourage the public to practice proper personal hygiene and nutritional supplements and nutritional management. I request all of this august audience to make a point of this and communicate with the public. And I thanks for the people, though August people, those who have been addressing us today on the scientific deliberations. On behalf
Sir,
participation and enlighten audience, particularly Sentence College students for this particular nutritional webinar. Thank you very much.
Thank you, sir.
Thank you so much, sir.
Thank you.
Next slide, ma'am.
Yes, ma'am. Well, ma'am,
Now,
second of announcement. Uh, Participants, just a little housekeeping before we get started. The audio of the
Funny.
participants will have to be muted throughout the session. If you have any questions during the presentation, please type them in the chat box. We'll bring them up after the presentation and will be answered by our speakers. Thank you. I now request Meena ma'am to invite our session chairperson, Dr. R. Ananthan, to lead us for scientific sessions.
It's my honor to introduce Dr. Ananthan. Dr. Ananthan is the Assistant Director at very prestigious National Institute of Nutrition, Tarnaka in Telangana, Hyderabad. And he has completed all his education, as we all can see, from Tamil Nadu, and his postgraduate studies from MSc to PhD from Bharatiyar University at Tamil Nadu. He's got more than 18 years of research experience, and his field of specialization is food chemistry, nutrition, and biochemistry. He has so far guided 3 full-time PhD scholars and has extensively worked for the development and standardization of analytical methods to quantify various nutrients and bioactive substances using sophisticated instruments. He is one of the authors of Indian Food Composition Tables, which we all had been using since 2017. His another area of work is to quantify bioactive phytonutrients and measure their free radical scavenge capacities in functional foods. He has a guideship in the Faculty of Biochemistry as well as Nutrition from Osmania University. He is a life member of Indian Dietetic Association as well as Nutrition Society of India. He has completed 3 projects and he has right now 3 of ongoing projects under him. He is a doctoral committee member for PhD students at SRM University as well as VIT University in Tamil Nadu. He's got several national and international publications to his credit. He's coordinator, SARC Foods Regional Center, Secretary, Indian Dietetic Association Chapter, Telangana Chapter, and FAO approved consultant in food composition. Now, over to you, Ananthan sir, for the technical session, please.
Thank you, ma'am. Thank you so much for the detailed introduction. Am I audible to everyone?
Yes,
Yes, sir.
Yes, sir. Very clear.
Yeah, thank you. Now we are going to start our scientific session. In this session, we have 2 presentations. The first presentation entitled Dealing with the Post-COVID Complications in Diabetes, and second one, Nutrition Insights by Type 1 Diabetes Children During the Pandemic COVID-19. Just before starting, I onset of from my own side, I wanted to congratulate both IAPN and the St. Anne's College for Women for arranging this wonderful collaborative webinar on post-COVID illness on the diabetes on this special day. It's a World Diabetes Day, which is very useful and very important requirements for most of the populations on this pandemic situation. The diabetes, once it was considered as a rich man's disease, but unfortunately this diabetes disproportionately impacts on the poor and vulnerable. And as you know that currently about 2/3 of the population with the diabetes live in low and middle income countries. As you also know that diabetes is a health problem of multi-sectoral issues driven by rapid urbanization, globalization, economic development, and importantly, deeply dysfunctional global food system. We cannot refuse that one because the current food system focusing only on the few crops that has caused the declining diversity of the diets and more dependence on the limited number of energy rich and processed foods. And this kind of trends is eventually creating the coexistence of overnutrition as well as and its associated diseases like obesity and diabetes. On the other side, the micronutrient deficiencies and undernourishment. This shift towards the calorie dense and nutrient poor food patterns is increasing the burden of diet related non communicable diseases. It's well known fact. Thus, the current food system are simultaneously delivering undernutrition and overnutrition, that resulting in more than 1 billion people hungry, and other side 2 billion people are overweight. The both ends of this malnutrition spectrum are very powerful for the diabetic epidemic. We cannot rule out this, because the link between overweight and obesity and related to the diabetes, it's already well documented. But what is less known is till now is the undernourished, particularly the undernourished mothers gives birth to the baby who are at a high prevalence or the propensity to develop type 2 diabetes in the later age of their life. Therefore, overcoming this disease requires really the global food system reformation, which would deliver optimal and sustainable healthy diet for all these populations, vulnerable populations. Considering the sheer scale and the complexity of the diabetes, the whole society approach is required, which includes the global agencies, government, NGO, and private sectors to solve this issue. I, fellow scientists from NIN, have been working on many projects, particularly on the importance of the food biodiversity, which will enhance the health status of many the people, which includes the indigenous peoples. I also work in association with the Indian Dietetic Association. Our fellows, our colleagues, the trained RDs, also they are working, and they're well trained on the diets or modified diets, or in order to control diabetes, doing various outreach programs, all those things. With this, I know detailed. I have taken many minutes for this. With these details, let us enter in the scientific session. The first presentation will be delivered by Dr. Ashwin Dhabi. I would like to introduce Dr. Ashwin Dhabi. I'm happy to introduce Dr. Ashwin. Dr. Ashwin has completed his MBBS from Gujarat University, working as a consultant physician in the metabolic and nutritional disorders in Sujeevan Hospital in Ahmedabad. He has done his diploma and expert certification from the ESPN, it's a European Society for Clinical Nutrition and Metabolism, United Kingdom. He has published several papers in national and international journals, which includes micronutrients role in intensive care patients. He also is one of the official ESPN lifelong learning teachers available in India. He is associated with the IAPN from 2013 onwards, and has contributed immensely in the area of pediatrics and clinical care nutrition. He has presented so many papers in various national and international events over the years, and he also has chaired many sessions at various state and national level conferences. Now, I hand over this, over to Dr. Ashwin to continue his presentation. I hope, as per the program, I can see that end of each presentations, we have 10 minutes for the interactive sessions where we can take up the questions.
Yes, sir.
Over to Dr. Ashwin. Thank you.
Thank you so much, Dr. Ananthan, for such a kind introduction. And thank you, Dr. Janki, Dr. Bhimrao, Dr. Meena Patange, and entire
Is the audio okay? Or
Now it's okay, but we are not able to hear from
amid the COVID pandemics.
Yeah.
sir, can you, Dr. Ashwin, your audio was not audible. Now also it's not audible.
I think there is some net issue with sir.
Okay.
I am audible now?
Yes, sir.
Now you're audible, sir, please. Yes, sir, now you're audible.
My screen is visible to all, correct?
Yes, yes.
So, good evening, all. And the topic given to me is very exciting, that how to foster care while dealing with a post-COVID complication in diabetes. If you look at the scenario that what started in China, in a very small province of Wuhan, we have seen that the disease has reached to almost every country across the world. But because of the dense populated cities and because of a very poor physical distance measures and illiteracy among the Indians, we have seen that the COVID has gone beyond the imagination in India. And the learning objective of this talk is to know the different approach in intervention to treat the post-COVID sequelae in diabetic patients. What you feel that the COVID is a disease only during the acute care setting in a hospital is not true. But these people, they'll end up with lots of other nutritional, metabolic, cardiopulmonary, and neurological sequelae, which may sometimes remains for lifelong. Also, we will learn little bit about evaluating diabetic patients during the COVID-19 therapeutic interventions. As we understood that as of now, we do not have any licensed medicines which can give us a successful outcome in a patients with uh, COVID-19 infection. Also, we will briefly understand about the sustaining the life support in a diabetic patient because COVID-19 has taken a huge toll among the patients whose diabetes was poorly controlled at the initiation of disease. And that is how we will all get acquainted to the general nutritional care in a post-COVID scenario. When you look at the SARS-CoV-2 background, we understood that there is a lack of acquired immunity because none of us had any exposure to such a deadly virus. So all of us, we remain without any neutralizing antibodies. So that is where, because of the lack of antibodies, we did not had any kind of herd immunity, and that is why the disease has taken a huge toll. Apart from that, we are not sure about the true rates of infection across various parts of the country because we have a limited capacity to test the people, and since the antibodies are not lasting for more than few weeks and the risk of catching reinfection is very high, and that is really a very scary situation, particularly when you look at the vulnerable people like children and elderly people with polycomorbid illnesses, which are the worst affected population with COVID-19 disease. With respect to the nutritional advice, which is being now considered as a most uh, important intervention in form of rehabilitation and in also in form of rejuvenation, because the impact of disease is lasting for few weeks to few months after the recovery from COVID-19 infection. And that is why there is now a reasonable evidence from the animal and the human studies that the antioxidant and related multi-micronutrient formulation and the nutritional support to increase and boost the immune response is the key target to tackle the COVID-19 menace. So therefore, the nutritional support is considered at this moment the most important and the appropriate intervention to deal with COVID-19. If you look at the evaluation of non-communicable diseases, which initially responded closely to most of us in 28th and the 21st century, we feel that most of the deaths were related to the cardiovascular disease or maybe cancer or chronic obstruction. disease and many other non-communicable diseases. But the root cause of all these non-communicable diseases looks like more or less similar in form of unhealthy dietary practices, or maybe harmful use of alcohol, or because of the altered lifestyle in form of physical inactivity, metabolic uh, complications like obesity, and the habits of smoking tobacco. So all this leads to volcanic eruptions in the non-communicable diseases even before the COVID-19 occurred across the globe. But with the advent of COVID-19, we are now seeing that there is a uh, uh, increase, parallel increase in the prevalence of non-communicable diseases. So if you look at the post-COVID scenario in a diabetic people, we have a very limited evidence, but the evidence now is continuing to emerge. And probably it is people with diabetes who are at an increased risk of more severe COVID-19 infection. Though the evidence quantifying the risk is not certain, but look at the demographic factors and look at the other metabolic parameters like increasing BMI and poor control diabetes has been associated with a worst outcome in patients with diabetes and COVID-19. So that is why uh, because of the COVID-19 infection, and initially due to the lack of availability of the personal protective gears, there were lots of disruptions which were caused by the pandemic in form of delivering a optimum care to all type 2 and type 1 diabetic patients. And that changes to the routine care, diet and physical activity, apart from the environmental, mental and the physical stress, which has led to the poor control of diabetes and increased risk to the COVID-19 infection and the infection related complications. So that is why we believe that there are some ways we can mitigate the risk, but then the collective efforts by all the healthcare professionals, in particularly medical specialists and the dietitians and the physical therapists, plays an important role with respect to the recovery and rehabilitation. If you very briefly, we will go through the pathophysiology of the COVID-19 disease. If you look at the routine critical ill patient, when they get admitted, then their journey generally takes a kind of two-phase pattern. One is the early phase, or we call it a F phase, which lasts for 2 to 3 days, in which the patients are in shock, and thereby their energy requirements are less, and that is why we see the phase of hypometabolism. But after 2 or 3 days, suddenly, even though they don't perform any physical activity, they stay critically ill in the bed, and in spite of their immobility, suddenly their energy requirement goes up, and which remains high for maybe few weeks, and then gradually when they recover, it comes back to normal, or maybe little more than the normal for few weeks to few months. So this is what typically occurs in a patient with uh, uh, other critical illness other than the COVID-19 infection. What happens in COVID-19 infection is the extension of this pattern in form of prolonged phase, which may sometimes take up to few days or maybe up to 1 week. And then there is a prolonged hypercatabolic phase, which lasts from few weeks to few months. And this prolonged hypercatabolic phase will adversely affect the nutritional status and will adversely affect the outcome from the COVID-19 infection. So this is very important with respect to the SARS-CoV-2 infection. If you look at the correlation between the SARS-CoV-2 virus and the pancreatic beta cell, There is a direct damage to the pancreatic beta cells by the virus itself, and also there is a damage which is induced by the cytokines which are released from the various immune and the endothelial cells, and all this will lead to hyperglycemia on admission in those patients who were non-diabetic before catching the COVID-19 infection, or those who were already diabetic will lead to worsening of their metabolic control, and that is where there is an increased risk of morbidity and mortality. And then later on, this all may become frankly diabetic, or we call it a new onset COVID diabetes mellitus. And all these pathological factors will play a role in mitigating the pathophysiology, particularly obesity, pro-inflammatory state, hypercoagulity. We have already seen the acute cardiovascular complication in form of acute myocardial infarction and cerebrovascular stroke in patients with COVID-19 disease. Or people with diabetes may become ketoacidotic, or even they may go into hyperosmolar hyperglycemic state and coma. Particularly older people with a very less immune reserve, or somebody with hypertension and cardiovascular disease, or somebody with a chronic kidney disease. All these conditions which leads to increased cardiometabolic stress, and that is why which is responsible for the poor outcome from a COVID-19 infection. If you look at the pathophysiology behind the biomolecular mechanism, uh, uh, the stem cells which are converted into various kind of cell lines, but particularly because of the exposure to the cytokines, this uh, stem cells which are converted into T cells or B cell or maybe natural killer cell, macrophage,
Yes.
and the dendritic cell. They
Yes.
all lead to release of pro-inflammatory
Hello.
cytokines. All these pro-inflammatory cytokines will adversely affect the pulmonary tissue, liver metabolism, acute kidney injury, cardiovascular complication in form of myocardial infarction, myocarditis, uh, or in form of gastrointestinal tract diseases like vomiting, uh, acute gastroenteritis, diarrhea, and also the disruption in the gut barrier, which leads to multi-organ dysfunction syndrome. So this is very important to prevent this cytokine storm, which is the driving force for all complication which follows the COVID-19 infection. So all these biomolecules which are released as a part of COVID-19 disease pathophysiology, which disrupt the hormonal and the metabolic milieu, and the endocrine response thus follows leads to the uh, uh, neoglucogenesis, that is the amino acids which are broken down in liver and muscle to supply the glucose to the entire body, and that leads to loss of lean body mass. And the metabolic response also depends upon whether the patients are having mild, moderate, or severe COVID illnesses. So if you look at the nitrogen loss, that also depends upon the whether the condition is mild. Say for example, somebody undergoing appendicectomy, or somebody with a pneumonia, then there is some loss of nitrogen. The normal loss of nitrogen in urine is close to 4 gram per day. So that is equal to almost 30 gram of proteins per day. But somebody with a severe sepsis, like say for example, we have seen that COVID-19 with secondary infection. So these people with such a bad lung and this secondary pneumonia, these people will spend so many days on the ventilator or on the critically ill setup And it is this patient, they will lose almost 4 to 5 times the nitrogen as a part of this COVID-19 pathophysiology. And they will lose close to 5 to 1 kilogram of lean body mass, or we call it a muscle mass per day, in order to supply energy to the rest of the body. So this is very important. This was number of meta-analyses which had been studied after the COVID-19 pandemic, and many studies have come from China. And if you look at the prevalence of diabetes was almost close to in double digit. Some of the studies, the prevalence was close to 1/3 of the entire population, compared to 10% in rest of the studies. But it is those people, if you look at where the diabetes prevalence was very high, the mortality was also significantly high. Say, for example, the mortality was almost 2 times compared to those people with a non-diabetic uh, uh, those people who were not diabetic at the onset of COVID-19. So this is very important. It's not only about the mortality, but also the severity of the disease, the length of stay in the ICU. Everything was very prolonged in patients with uh, COVID-19 and type 2 diabetes. Apart from diabetes, it was more important the control of diabetes. So poorer the control of diabetes, it was the very closely related to the uh, uh, morbidity and mortality. So somebody with a glyco HbA1c double digit, then if you look at the mortality was almost 2 to 3 times compared to those people with a HbA1c which was less than 8%. So that is where very important, that if you have a poor control of diabetes, then you are at a risk of multi-organ dysfunction. And if you had a good control of diabetes, then the morbidity and mortality was less. And that is not only restricted during the hospitalization. This was a very wonderful study and observation made by Dr. Tommy Sederholm from Sweden, where he studied the post-discharge patient outcome in those patients who lost the lean body mass during the hospitalization versus those patients who did not lose the lean body mass at the time of discharge. And he observed all the patients for 9 months, and what they could found that those patients who lost the lean body mass during the hospitalization, and they had a higher mortality even following the discharge compared to those patients who maintain their nutritional status. So this is very important, the role of a nutritionist in a patients with COVID-19 disease and the type 2 diabetes. Apart from that, there are certain drugs which can give beneficial outcome in a patients who are treated for type 2 diabetes. Say, for example, the DPP4 inhibitors and the metformin. Now we have the preliminary data that patients taking these two class of drug, it reduces the expression of angiotensin converting to enzyme receptors on the cell membrane, which is the entry gate for the SARS-CoV-2 virus in the cells. And those patients who were taking other class of drugs like sodium glucose luminal transporter 2 inhibitors, or in short we call it SGLT2 inhibitors, then this patient had a higher prevalence of diabetic ketoacidosis, because they had a higher chance of cytokine storm, and also the risk of uh, 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 ketoacidosis was very high. Somebody who were taking pioglitazone, all of you know that this leads to accumulation of salt and fluids in the body. so that this volume and fluid management was also very critical as a part of COVID care. And that is why we just do not want the lungs to be flooded with fluids, and that is why this will compromise the breathing mechanism, and that leads require the increased support in form of ventilatory care. So this is very important to evaluate all patients on admission and to assess the risk of morbidity and mortality based on their comorbidity. So what the simple evaluation we people do is to identify the number of risk factor. So if you have more than one risk factor, then the risk of catching morbidity and mortality goes up. So of all the risk factor, we found that it is the diabetes, obesity, smoking and hypertension were more responsible for a worst outcome in a patient with COVID-19 disease, apart from somebody who already had a end organ damage in form of chronic COPD or maybe coronary artery disease, heart failure, stroke, or chronic kidney. And we have number of mechanisms to identify such vulnerable people with a worst outcome by doing some kind of biochemical assay. All of you know that we always check the D dimers or the ferritin values. We now consider ferritin is one of the very important marker for knowing the inflammatory state. And also we would like to know the cardiac troponins and the NT-proBNP to know about whether there is an element of myocardial injuries there or not. And that is where we believe that apart from so many other markers we consider to know the progress of the disease in a critically ill patient. And remember, whenever you see that the diabetic patient is getting admitted in the critically ill patient, or any critically ill COVID patient becomes hyperglycemic or becomes frank diabetic, we generally stop all oral anti-diabetic drugs and we switch to insulin for the glucose control. That is where we believe that this is appropriately work in combination of antihypertensive and appropriate anticoagulation. So in a COVID era, what we learned that since the beginning of this COVID pandemic, all our routinely cared patients, they had very limited access to go to a hospital. So this is where we found that there is a robust scope for the teleconsultation, and that can be done remotely without touching the patient. And that is where the need of doing a face-to-face teleconsultation to identify all those vulnerable diabetic people, whether it is a type 1 or type 2 diabetic, and modify their current anti-hyperglycemic medication. And we can recommend them doing a blood test, and accordingly we can optimize the anti-diabetic nutritional intervention. But apart from that, in this COVID pandemic, what is more important is the community and the self-management. Every patient should know that what they should do in case of sickness, or we call it a sick day diabetes management. So that is where they have to increase the glucose checking, and if their sugars are out of range, they have to adjust their anti-diabetic treatment algorithm. Or if they are not capable to do so, they have to call the concerned medical advisor and take an appropriate advice to bring the optimum control of diabetes. So there should be a clear point of contact for all patients, and that is where they should be taught the management of diabetes as a part of sick day rules, and they should be have access to the renew of their current diabetic prescription as long as they wish to continue. but they should be part of the proactive management as a part of COVID care amid uh, diabetes management amid the COVID pandemic. Apart from that, what we found that most of us have become physically inactive. Lots of us have become addicted to the gadgets, and that is why we felt that the doing regular exercise is also necessary to boost up the immune tolerance and the immune response. So whether we are quarantined at home or we are in a containment zones, we should not become literally physically inactive. So that is why we have to incorporate all kind of routine exercise in form of leisure time activities like playing a badminton or maybe walking or simple stretching and even a yogic exercise. And that is which is very important to maintain the muscle protein synthesis and the immune competency. And that also relieves the stress which are coming from the isolation. So any physical activity of any nature is going to give you some benefit. So that is we always recommend avoid lying down except for 6 to 8 hours of sleep at night. Even while you're doing a office work, we always ask all of you to do some kind of intermittent walking. It's always encouraged. About the supplementing multi micronutrient pills, since we came to know about this COVID pandemic in a winter, and winter months are the months we have the lowest vitamin D. This low vitamin D level has been associated with number of viral infections like influenza. So from our previous and also from a robust data from the COVID studies that all patients whose vitamin D levels were in single digit had a increased risk of morbidity and mortality. So we always try to build up the vitamin D level in a range of 50 to 70 nanogram per ml. So this is where we just recommend patients to take regular sorts of vitamin D which are available in form of 60,000 unit which can be taken every weekly for 8 weeks, or regularly we recommend them to take 10 to 100 microgram per day. And in critically ill patient, we just like to give a single shot of 6 lakhs units of intramuscular vitamin D at the end of first week of ICU care. Or if patient is taking food orally, then we just like to give 60,000 unit continuously for 4 days to build up the vitamin D level. So this is very important with respect to vitamin D. Vitamin A, already we know that it's a retinoid compounds and basically it's an anti-infective vitamins. And many of our body's immune response depends upon the vitamin A adequate level. And fortunately in India, we consume lots of fruits and vegetables, and it is all these fruits and vegetables will give us carotenoids, which are nothing but a plant-derived precursor of vitamin A. So this is very important promising option for treatment of COVID-19 infection. And all of you know the valuable beta carotene sources are all like somebody consuming good amount of carrots or maybe pumpkins, sweet potato, spinach or any colored fruits and vegetables will give you ample amount of vitamin A. Apart from all those essential vitamin, we need this COVID-19 is basically a disease with lots of oxidative stress. And to contain and mitigate this oxidative stress, we require antioxidants in form of vitamin E and vitamin C. So this is what generally recommend people to basically take it from a diet. But somebody who's because of the anorexia and because of the loss of smell and taste, they are not able to take the oral diet appropriately in form of energy and the micronutrient requirement, then there is a need to supplement this vitamin E and vitamin C from the supplements which are available in the market. Apart from that, zinc is required in a mega dose. So the general requirement of zincs are close to less than 10 milligram per day. But in a patients with COVID-19 infection, we as a nutritionist give doses up to 220 milligram per day. And zinc is required for the antioxidant enzyme which is dependent on zinc, that is superoxide dismutase. So the superoxide dismutase, it depends on zinc and the copper. This is very important that zinc and copper generally we get enough quantity only from the animal source food. They are not so available in plenty in a plant derived food. So always incorporate all these multi micronutrient which have been shown to increase the T and B cell immunity in human studies, including the elderly population. About other supplements which are running in fashion in our country is complementary and alternative medicine and lots of herbal products which are claiming to be COVID protective or which are claiming to be effective against the COVID sequelae. But as of now, we do not have any robust data to document such effect. And many people, they drank the traditional liquor believing that the alcohol kills the COVID virus. But in fact, they kill themselves in race of rescuing themselves from catching such a highly contagious disease. Also, people believe that eating garlic or onion is, yeah, it's good and healthy to consume garlic and onion, but there is no direct evidence from any studies from current outbreak that eating garlic has protected somebody from COVID-19 disease. But since yes, they contain good amount of oligosaccharides, which improves the gut barrier and reduces the metabolic endotoxemia, they are a good plant-derived foods to be consumed. So that was all about the diabetes and its management in form of post-COVID care, and which is going to take the ample amount of time of not only the medical professional but also all nutritional related professional, because this diabetes is a catabolic disease by itself, and on top of it, if there is a
So your voice is not audible.
they catch the COVID-19
Sorry,
nutritional
sir,
status related to.
we missed a point of.
Apart from diabetes care, we already know that the diabetes and the heart disease, they have a common soil hypothesis, meaning thereby they originate from a common seed. So that is where we believe that the managing cardiovascular disease is also equally important, because cardiovascular disease and diabetes mellitus, they go hand in hand. And apart from what we learned, that the SARS-CoV-2 cytokine not only affect the metabolic pathways, but it also affect the cardiovascular pathways in form of astotropism, or in form of the systemic inflammation, or in form of the hypoxia related and endovascular stress. And all this leads to endothelial dysfunction, disruption, or leads to the myocarditis and the arrhythmias, or lead to the coronary artery or the systemic circulatory thrombosis. You have seen lots of people with microthrombi all across the pulmonary vasculature, or maybe deep vein thrombosis in the legs, and then pulmonary embolism. All this leads to kind of coagulation abnormalities, myocardial injury, pulmonary injury, ischemic stroke, and that increases the uh, morbidity and mortality. So many patients with COVID-19 disease and diabetes, they required preventive measures for venous thromboembolism to prevent the cardiovascular complication. So this is very important that since the routine care has been disrupted because of the COVID, we have to develop a kind of telehealth platform in which we will be giving not only the medical consultation but also the dietary consultations, physiotherapy consultation. We can do the group sessions like what we are doing now to improve the care after recovering from the COVID-19 infection. So the message today I just want to pass on to all of you is that the balance of good health always lies in balance of good plate. If you look at this plate, two-thirds of the food what we should consume should be like fruits and various vegetables, and we already learned that they are a very rich source of supplying the vitamins, minerals, fibers, and rates of bioactive components. Also, we like to take the good sources of protein in form of meat, fish, eggs, beans, and the milk for all those vegetarian people. But always keep your beans or legumes and pulses in rotation, because many of these pulses they are limiting some of the amino acids. So you have to rotate your pulses on day-to-day basis to get all the amino acids which are required for health and rejuvenation. But certain foods which we believe that which are pro-inflammatory and which alters the metabolic pathways in form of sugary sweetened beverages or in form of a junk food in form of a high fat and highly refined carbohydrate. I think we should be able to curtail as much as we are able to reduce them in our day-to-day life. So this was all about managing the uh, diabetes mellitus in a post-COVID scenario. But what we understood that in spite of all the measures being taken by government and also at a public health level, but we reasonably we should accept that we are still far behind from reaching the goals. So very simple measures like washing the hands, but then the techniques of washing the hands and then maintaining the physical distance without any social barrier, and using the mask appropriately, covering both nose and the mouth, and then cooking the food appropriately so that we do not have the residual infective materials on the uh, grocery sources. And that is, we should always avoid the unprotected contact with a live, wild, or farm animal. So this is what basic precaution we should be taking to reduce the risk of catching the coronavirus disease. So with that, I thank all of you for giving me this wonderful opportunity to discuss the ideas about taking on the diabetes care in a post-COVID scenario. And I welcome all of you to be part of one and only European certified and accredited LLM workshop, which we will be hosting in the second week of February during the IAPN International Conference ICNC 2021. And in view of this COVID pandemic, we are going to take the topic of nutrition in pulmonary diseases, apart from enteral and parenteral nutrition, and nutrition in liver and pancreatic diseases. I thank you so much, all entire team of IAPN Hyderabad chapter, for allowing me to discuss my ideas on management of diabetes in COVID-19. Thank you so much.
Thank you so much, Ashwin sir. That was really a tremendous session. Ananthan sir, should I ask the question?
Yeah. So actually, sir has covered, from all the aspects for the post-COVID pandemic, not only for this is diabetes, even he has shown the importance of all non-communicable disease in spite of, the mechanisms, particularly the pathophysiological mechanisms he has explained. And I hope it will be very useful for all our participants. And if you allow, then shall we go for the question and answer session, or
We'll go for the question and answer session, sir. I will just look into the chat box and ask questions.
Funny
Yes,
Kumari,
please
I just
go
look at the questions in the chat box. One question is how to prevent damage of pancreatic beta cells from COVID virus. So all of you know that the COVID virus, they enter the cells through angiotensin converting enzyme to type 2 ACE2 receptors. So the one of the way to prevent the expression of ACE2 receptor is to good control of diabetes. So if you have a bad control of the diabetes, this excess plasma sugar will lead to increased expression of ACE2 receptor. And then certain anti-diabetic drugs like DPP4 inhibitors or glucagon like peptides, they and the metformin, these are the drugs which prevent the expression of ACE2 receptors on the pancreatic beta cells. So the best way to reduce the damage to pancreatic beta cells is by good therapeutic armamentarium, and the other good way is to maintaining a healthy lifestyle.
Yes, sir.
There is one more question about the asthmatic diabetes. All of you know that the asthma and diabetes both are inflammatory disease. So one good way is to reduce the inflammatory stress. If you look at the current consumption of plant-based oil, omega-6 fatty acids are very high, and the consumption of omega-3 fat is very low. So we see very high ratio of omega-6 to 3 in our fat. With the normal healthy ratio is 4:1 or up to 6:1.
yes.
Sir,
Shall we go to the next question, or
the sir is, I think, had some net problems, so stuck there. Ashwin, sir?
But the current ratio is we are not able to increase the consumption of us. We can't consume that much of.
Sir, you're on mute and you were stuck for a moment.
I guess we missed him.
Yeah, now it's okay, correct?
yeah.
Yes.
Now it's okay.
So omega-6 we have to reduce in this thing. And omega-3 fatty acid, we can take so many supplements so that we can tackle. In asthmatic patients, particularly having COVID-19, many times we need to give them steroids. And all of you know that the steroid worsens the diabetes control. So that is why we optimize the diabetes by giving optimum insulin combination. And that is where we can control the diabetes with insulin. And sometimes this asthmatic patient, they require lots of steroids to prevent the lifelong damage to the pulmonary tissue. Any other question, Fani Kumari, can you read out so that if time permits?
Yes, sir. I think you've read out all the questions. Mayuri, anything?
Yeah. One question which is asked directly to my chat. Okay. So how, sir, there's a question on how to treat chronic myeloid leukemia patient along with diabetes, type 2 diabetes and obese. Any particular dietary guidelines for this?
See, anybody with a chronic leukemia and the type 2 diabetes and the obesity, all of you know that the obesity and type 2 diabetes, they need to be controlled because these people, they have a pro-inflammatory state. So basically what happens that sometimes in chronic myeloid leukemia, they sometimes need intermittent courses of chemotherapy with steroids. So this they have a hyperglycemia and hypoglycemia, or we call it a glycemic variability. So the optimum combination of oral and the injectable insulins and the oral anti-diabetic drugs. And about the obesity, we do not recommend these people to lose weight when they are acutely ill. But when they recover and they are in a remission phase, we can try some kind of weight loss under the supervision of an nutrition expert. So this will lead to the improved outcome in patients with chronic myeloid leukemia. But remember that when in acute stress or when they are undergoing chemotherapy and the steroid treatment, we have to optimize the energy and protein for maintaining the nutritional adequacy. This is very important.
Is that done, Puri?
Yes, it's done. It's done, Funny.
Yeah.
We can go ahead.
Any questions from the audience side?
I think they've typed all in the chat box, sir, and we have read out. Sir himself has read out the questions.
Right. Shall we move to the second presentation?
Yes, sir, please.
Yeah. So the second presentation entitled Nutrition Insights by Type 1 Diabetes Children During the Pandemic COVID-19 by Dr. Brindavani. Dr. Brindavani works as a consultant nutritionist at Rainbow Children Hospital for more than 14 years, and her area of research work is on pandemic nutrition, fetal-maternal nutrition, and body composition studies. And she holds a doctoral degree in nutrition and continuing her credits for the pandemic nutrition ADA. She has highly influenced citation articles in particularly European Journal of Clinical Nutrition in body composition and 4 more other international publications in renal nutrition. And she has delivered so many invited guest speech delivered lectures in other countries like Hong Kong and Switzerland for renal nutrition and infant nutrition. And she also is a reviewer for article in body composition for Annals of Human Metabolism. With this introduction, I would like to welcome Dr. Brindavani to deliver a talk on this topic. Please, over to you. I think your mic is on mute.
You're on mute.
Yeah, sorry.
Yeah, now it's fine.
Thank you very much for the introduction, and I had a very pleasant on this lecture to begin with. And can I share my screen?
Yes, Brinda. Sanjana, I think you can stop sharing the screen. Ma'am will do it. Yeah.
Is my screen visible?
Yes.
Okay.
Yes, it's visible.
Yeah. So today I'm going to talk about nutritional insights for type 1 diabetes subjects during pandemic COVID-19. So this topic was decided because, during discussions, we found a lot of children having type 1 diabetes newly onset during this pandemic situation. And 1 second, I'm just adjusting my screen here. Yeah. Just a minute. Is my screen having some problem?
Yes, Brinda. We are not able to see it now. Share it once again, ma'am.
Just a minute.
Yeah.
I'm not able to log in.
Okay. You want us to share?
Yeah, I think so. That's better.
1 second. Now it is seen, Brinda.
Yeah.
Still you want us to share? We will.
It's seen.
It is
So I'll
seen.
just put it on the. Yeah. Is it visible now?
It's visible. It's visible. We are on the first slide.
Yeah. 1 second.
You enable editing over that, you will get it. Get it to full screen.
Now this is completely touch one, which my mobile is.
That's right.
Yeah. I'm not able to see my screen in any case.
Okay. I'll do one thing. I'll start sharing it.
Yeah, 1 sec. All right. But then I need a slideshow. Yeah. Are you able to see my slide?
Yes, we are.
You are? Okay. So can again go ahead?
Yes, please. Yeah.
All right. Sorry for the trouble.
Problem at all.
All right then. So during this pandemic period, a lot of information was being given on COVID-19. Basically, the biochemical pathways and metabolic pathways, and a lot of information, in-depth information is given. So for me to attach type 1 diabetes to COVID is a big tedious task for me, because type 1 is a very small segment of the problem with the bigger problem of COVID-19. But since we've seen at least 3 to 5% of pediatric children developing type 1 diabetes, so the thought of presenting a type 1 diabetes in COVID-19 situation became important. So when we're looking at the kind of, what are the topics that I can go with? So I've decided on 7 topics that I can discuss. That is transmission and comorbidities, and, the relation of weight and glycosylated hemoglobin. And there is a postulation how to go about with COVID-19 treatment. It's divided into 4 phases with 5 targets of support. In the 4 phases, the preventive phase, and I'll be discussing in detail about these 4 phases. And in the 5 targets of support, the foundation is the one where the nutrition support plays an important role. And ultimately, I'll be discussing about how the new onset of type 1 diabetes happens. Now, this slide, though everybody knows about how the COVID-19 gets into us, it's an animal to human transmission, and it's an RNA virus. The difference between a COVID virus 2 and the previous COVID is the spike protein that this RNA has. The spike protein, actually the transmission is by 2 routines, like one is the fecal and one is the airway. Now, the airway is the more predominant one compared to the fecal. So when this RNA is into the human body, gets into the human body with either ways, it actually attaches to the ACE2 receptor. So the ACE2 receptors actually control the BP mechanism or the blood pressure mechanism in the human body. So once this RNA attaches to the ACE receptors, there is a cytokine storm in the body which is created. That means the body produces a lot of cytokines. So these cytokines, when they go into the it's an innate immune system. So when the cytokine storm is there, it works onto the the viruses, and there's a macrophages and all the protein bodies and the dead cells, and this is called as a cytokine storm. Because I just want to make it very brief, not to be very explanative in this, because I want to deal with a lot of nutrition concepts into this my topic. So this cytokine storm, if it's affecting the circulatory system of us, then we have the multi-organ failures and yeah, just a minute. Yeah, it leads to the multi-organ failure. But if it's going to be more effective on the lungs, we may be having cough and cold. And if it's going to affect our brain and hypothalamus, we may be having fever and it's more a thermogenic event. That would mean if somebody is COVID positive and having fever spikes, temperatures which are uncontrolled, that means it's mostly affecting the brain part of it. Suppose the patient is having more of breathing problems and kind of associated with cough, that means it's more affecting to the lungs. But if it's into the multi-organ failure, that means it's into the circulatory system. So by the symptoms of the positive patient, we can understand where exactly the insult is. Based on that, we can actually further our treatments. Now, the receptors are found in 6 different areas. One is the nasal, wherein we have this, we have 2 receptors actually, AEC2 receptors and DMPRSS2 these 2 receptors. If you can see in the slide, the second column, there is one orange dot. That means we only have one binding site in the nasal. But when it comes to lungs, we have both the binding sites. When it comes to ileum, that means even the intestinal ileum has a binding site. We have 2 binding sites. When it comes to heart, it's 1. Eye has 2 and the liver has 1. That means these are the binding sites for the COVID virus. But what happens is when we take through the airway, it can get into the lung. That means the surface area is more. That means the insult from the nasal to the lung through the airway is more compared to the ileum, because if we have a kind of fecal contaminated food and we consume that, through this transmission, the protein could be digested in the small bowel. By the time it reaches the ileum, though it has 2 binding sites, the absorption or the attachment to the ACU2 binding sites is minimal. So that means we may have a GI symptoms and may have a diarrhea or bloating of tummy and things like that. But when it comes to heart, that means the invasion already happened from the nasal to the lung and it should be into the circulatory system. That's when we get into the heart. Eye has 2 binding sites for the COVID virus, but the 2 binding sites, the surface area of the eye is smaller. So the insult could not be as large, damaging the whole system of us. And when it comes to the liver, that means it's already entered the circulatory system or it entered the GI system and it's going into the liver. That means the most prone areas for the binding sites are nasal and the lungs. And third would be the ileum. So this why we have to go into the transmission is because when we deal with the children, we really need, because children do not complain of their problems. It's the parents who represent the problems. They can't speak for themselves. So we really need to understand where the insults are and how, at what magnitude the insults are. So at what level can we treat? Suppose if the insult is marginally high in the GI system, that means the digestive system is kind of compromised. We need to go into total parenteral nutrition at that time. Suppose the insult is only the lung part of it, that means we need to go into fluid restriction and change the protein so that the lung rehabilitation is much faster. Now, looking at the comorbidities, there's an extensive research done on the comorbidities. This is a elsewhere publication, but still we had a spelling mistake in their graph. Fatality rate was written as fatality rate. I couldn't change it because I just wanted to represent the slide as a slide. So when we see this, obesity had the highest fatality rate compared to the other problems, which is 68%. And diabetes had more frequency. That means obesity is an inflammatory state. That means when we have excess adiposity, the body's inflammatory state is high. That would mean we have high sugars, we have high blood lipids, and most of the immune cells are embedded in the fat tissue. That's the reason why the inflammation in the obese people is much higher compared to well-balanced weight persons. So because of this high inflammatory state, because obesity is a pro-inflammatory situation, so the rate of death is very high. And even in children, the rate of death is very high compared to diabetes. Now, just to briefly understand what is healthy glycemic control and what is a type 1 and type 2, I just wanted to present a slide here. So generally type 1 diabetes children are very lean. They're not so obese and they're very insulin sensitive. Insulin sensitive means a small amount of insulin is needed for a good glycemic control. So what happens in type 1 diabetes is the amount of insulin produced by the pancreas is limited, or there is no insulin produced for adequacy. So the glucose is high and it's like hyperglycemia in type 1 diabetes. In type 2 diabetes, there's an overproduction of insulin. That means it's kind of 3% more of insulin produced to the glucose ratio of 1%. So what happens is the cell starts resisting it. So to take one glucose molecule, it will have a competition of more insulins also. So the exchange is limited. So the cell has a kind of, resistance when high insulin levels are there. That would mean there will be high insulin and high glucose in type 2 diabetes. So in type 1 diabetes, the lack of insulin production would be the major situation. Now, the major lesson that we have learned during COVID-19 is the relationship with the BMI and glycosylated hemoglobin. So children who are having less weight, that means less than 20 kgs per meter square, had double the risk compared to children who had 25 to 29 kgs per meter square. And the death was highest in a BMI of greater than 40. That means this is a U-shaped relationship, that children who are undernourished and children who have higher BMI. So these children who have higher BMI, not necessarily they had, kind of metabolic risk profile, but still the obesity per se itself predisposed to COVID risk. And even glycosylated hemoglobin, a 6 to 7 range was preferred to be more having a control of the outcomes of COVID-19, but a glycemic level of glycosylated hemoglobin of 10% more had more predisposition of COVID death. The 4 phases of COVID are prevention, infection, escalating inflammation, and recovery. And this is a kind of a 400 article based study done by Yannick. And this is one of the landmark paper where he combined all the research articles and then given us a protocol how to go about. And he said there are 5 target support areas. There's a foundation, which is predominantly nutrition support. The second is antioxidant, and the NK cell support and helper cell supports and anti-inflammatory support. Now, this is the slide where on the top you can see it's prevention, infection, and explanation of inflammation and recovery. And now here the 5 areas you can see the foundation. The foundation is the green line, which is actually carried from all the 4 areas like prevention, infection, escalation, and recovery. That means the support of vitamin D, A, zinc, C, and melatonin is again one of the most important supplement which is given in COVID, which is actually the night hormone which is produced. So it has a very important role in actually minimizing the infection rates of COVID virus, and also fish oil supplements and a high potassium diet. Now, we're coming to the 4 phases of COVID-19. Since the nasal and the lungs have 2 docking sites, the prevention of social distancing and masks play a very important role. So few take it very lightly, but the distancing and masks can reduce the risk by 60 to 70%. And they also found stress reduction helps a lot of prevention, because stress itself is an inflammatory state. Stress produces a lot of steroid hormones like cortisol and other inflammatory hormones. So basically practicing some kind of non-stressing activities like yoga or playing walking at home and listening to music or playing kind of indoor games really helps in stress reduction. So prevention of stress is very important in the protective phase. And reducing baseline inflammatory markers like not having a high sugar diet and controlling your sugar levels and keeping your lipid profiles down. These are very important to make the inflammation markers better. And addressing nutrient deficiencies. All of us would have some kind of nutrition deficiency, like an iron deficiency, or a folic acid deficiency, or a B12 deficiency, or a zinc deficiency, or something or the other. So, checking into your nutrition deficiencies by looking at your nails or your skin or hair or taking a biochemical test like your CBP or something like that. Trying to address your nutritional deficiencies is very important, and also giving yourself the key nutrients which help the immune system. So that we'll be discussing a little later. So once you are infected by COVID virus, you are predisposed to GI symptoms. The GI symptoms is because basically you have receptors in your ileum, so you may have a GI symptoms like bloating, gas, and kind of colic pains and nausea and vomitings. And you would have fevers because it also affects your brain, and headaches, and a lot of lethargy because your muscles are involved. So a high protein diet with adequate micronutrients is very important in your infection state. Now, in escalating inflammation, that means it's a very dangerous phase that you can, kind of your multi-organ failure is very close to it. At that time, you have loss of taste and smell. That's when you need to go to nutrition, and the peptides play a very important role. So, because protein digestibility becomes a problem. And there you can go for tube feeding, and a little bit of fluid restrictions are important when you have renal failures, and carb control is very important because you'll be treating with steroids and your sugars can go up. So that's when you are going to work on your carbs, trying to spread across the day, and also controlling the night sugars are very important. And you can also use MCT oils because they give the direct energy to the intestinal villi. So, but again, MCT oils can also give diarrhea if at all we're giving high quantities. So try to space your MCT oils with the peptides, or choose a peptide feed which has an MCT based. Now the recovery is sounding good because we are trying to recover from COVID, but the important thing is to recover your lungs. The choice of the proteins to limit the fibrosis is very important. Whey proteins and egg white proteins are found to actually improve the lung health. So try including your protein to 1.2 or 1.5 grams per kg. And restoring the organ function is very important. By that time, your liver functions are important. The insult could be on the liver, could your enzymes be high, or bilirubins could be high, or the renal failure could be there, or any other organ functionality will be there. So what kind of proteins and what amount of protein you can give, or whether you can use an MCT based, and resuming appetite, because in the recovery, if your patient or your child is not eating, that's going to be very difficult because you can't discharge them on a tube feed. So resuming appetite when they have lost that appetite and taste and smell becomes a challenging issue. So that's the time that you have to have night feeds, like sip feeds. Like we try to allow around 4 sip feeds in the night, and then try to put the oral diet in the morning. So optimal recovery is a very gentle phase because based on the recovery, we don't get back an escalated inflammation of COVID again. So, the recovery phase lasts for 15 days. Even after discharge, we need to see that they gain weight and they eat well and without any GI symptoms, and kind of maintaining their sugars. Now, the foundation has got lifestyle changes and also kind of dietary interventions. So they found sleep to be the most important thing for the foundation stage of nutrition support. Exercise and sleep are also placed into the foundation for nutrition support. Healthy sleep is anti-inflammatory because you have a lot of growth hormone during your sleep, and also it helps promote T helper cells like T1 cells. Suppose you have a very disturbed sleep, a lot of dreams in your sleep, and you get up in the sleep and you mostly awake in the sleep. That means your T1 helper cells are not promoted and your T2 helper cells are there, which are not so effective as T1 helper cells. And melatonin is a hormone which is produced during sleep, and it's an anti-inflammatory. Now that's the reason why we are trying to use it as a drug during COVID treatment, and it has been found beneficial. Stress is another one because the chemistry of stress is very inflammatory. You have cortisol produced during stress, and cortisol has kind of a massive role on the immune system. And you're using steroids during COVID treatment, so that also has an impact on your hunger and your sugar levels. So this is very important that we keep our cortisol levels down and try to do activities, and or even in the pandemic situation. That means pandemic situation itself is a chronic stress of being at home and working from home, or trying to maintain distance and not meeting people, and trying to be alone, or trying to work from home. So that chronic stress and an insult of COVID is an acute stress. So complete stress with steroids is actually a very difficult situation. So try not to become, kind of stressed in this pandemic situation. So even if you're affected with a chronic stress of COVID also, we should have the innate ability to come out of the stressful situations. So glycemic control and inflammation. So insulin resistance and metabolic stress is inflammatory. As we all know, obesity is there, and glucose GGT is important, but most important is not the fasting blood sugar, but the postprandial glycemic support, because the moment you have a high sugared diet, immediately your insulin shoots up. That means your insulin shoots up when the insulin resistance is there. So your sugars are very high for the next 4 hours or 3 hours. That's the time when your body is again compromised. So trying to keep your postprandial glycemic control is important. That means suppose you have a GGT which is high, versus your fasting is showing less and your second and third hour is showing more. That means you need to change your meals. So low glycemic food is important, but each food has its own different response in each individual. For example, somebody would respond with a very good glycemic control with wheat, but somebody would respond with oats or rice. So a few of my patients do respond very good and brilliant with rice, but not with wheat. So we do not know how the GI system responds to each grain, and the carbohydrate load and the glycemic load of that grain, or the combination of the diet they take, or the time of the day they take. So the glycemic load of foods is important, and specific foods glycemic responses in each individual is important. So anybody who's type 1 diabetes, it's important to know that how much of glycemic control they have with rice, and how much they have it with wheat and with oats, and try to titrate their diets with the specific grains and amount of grains during this COVID period, and also see that they are not into spiking carbohydrate diets in between two major meals. And there's an obesity and hyperphagia and sitting at home and working from home and online classes. So the children are always hungry, and obesity makes them hungry, and quick frequent snacking and nighttime snacking, and snacking during study. So this is quite important to control. Try to give a high fiber diet in between two major meals, so that their hunger is controlled. And a lot of research has shown that plant-based foods, like mostly plant-based proteins, are more anti-inflammatory than animal-based proteins. And the one animal-based protein is eggs. Egg whites are most commonly found to be protective compared to meat and chicken. So fish and egg whites can be included more into non-vegetarian proteins compared to animal proteins. And plant-based proteins have a very beneficial role in COVID-19. So try avoiding foods with chemical additives and trans fatty acids and oxidative fats and other inflammatory foods. The other thing that they found was the microbiome balance, quite important, because we have helpful bacteria both in the lungs and the GI. So when lung is affected, the microbiome in the GI gets affected. That means, you may have GI symptoms if the lung is infected, or if the GI is infected, you may have lung symptoms also. And when you give a high dose antibiotics, what happens is the GI helpful bacteria are not there. That would mean it also helps the lung to minimize its helpful bacteria. So, so the microbiome plays a very important role in COVID-19. That means we need to take a lot of probiotics and helpful probiotics, so that the gut probiotics are going to be very helpful for the lung also. Vitamin D, as already discussed, the most of the studies which are into circadian rhythms, the morning most, it's actually vitamin D is a hormone. So the vitamin D and melatonin, they both have a major important role in the immune function in the morning and the daytimes, and mostly important in the metabolic functions of the cell also. So a lot of research has been put into vitamin D and melatonin during COVID times, and it's understood that lung fibrosis can be inhibited or by vitamin D supplementation. That's very important. So we need to support both in the preventive stage and in the 4 stages of COVID the adequate vitamin D levels or the supplemental levels, so that we do the cell function is good. And most of the vegetarian food doesn't have, so I think fortified foods are very important for the vitamin D supplementation. Coming to A, it again, all these fat soluble vitamins A, D, E are very, very important for immunity. So this one impairs the antibody response, and it decreases the level of helper cells if they're deficiency. And the muscle integrity, the mucosal integrity lining and GI linings, they're supported by vitamin A and E together. And supplementation of vitamin A helps resistance and recovery rates. And a lot of our food has vitamin A, but genetically it is found that few do not absorb beta carotene or the vitamin A groups from the food. The moment they have carrots or any kind of colored vegetables, they have a diarrhea or they have gas. So those are the particular sect of people, especially children, they don't absorb beta carotene from the vegetables. Maybe their GI doesn't tolerate so much of fiber, or maybe some other difficulty. So if you find your kids not tolerating a deep colored fruit or a vegetable, then I think in this COVID period, kind of therapeutic supplementation is very important, because it's not how much we give, but it's how much is absorbed, and how much is actually metabolized in the body is very important. So a few kids, maybe if they're on a high milk diet or if they're on a high fat diet, at times the micronutrients are not absorbed. Or if they're having a mixed diet, like they have a breakfast and milk and egg together, at that time, there could be some of the micronutrients which are not absorbed. So, once we understand, whenever you give a deep colored fruit or a vegetable to a child and you see there are differences in the GI symptoms like gas or bloating or kind of tummy pains or something like that, try to put your deep colored fruits and vegetables separate, not with a mixed diet. And if still the symptoms are there, that means during this period, you may have to opt for a therapeutic supplementation. So vitamin C is also very important. It's important for the immune system. So apart from fat soluble vitamins A, D, E, C plays this is a water soluble vitamin which plays an important role, especially in infections. And in COVID period, we did understand it really works on the lung health and the microbial protection, and at times, but it's not heat stable. So any vitamin C food that you cook, it's kind of it's not heat stable, so you need to give fresh vitamin C. But then trying to give orange juices or something like that would increase the glycemic level. So try to include a fruit or a vegetable which is fresh. And in children, the digestibility of fresh vegetables, raw vegetables with high fiber and vitamin C is questionable. So at that time, you can do a supplementation. Fish oils, yes, they're found to be very pro kind of anti-inflammatory, and most of the antibiotics, because oils are the ones, the lipid molecules are the ones which carry all the proteins or antibiotics in the body. They are the ones which are very helpful to mediate any kind of protein or micronutrient or any kind of antibiotic in the body. So we have EPAs and DHAs, and we have E series and D series resolvents. So they play a very important role in the kind of resolution stage of inflammatory process. Seafood is good, but in vegetarian diets, this is limiting. So though we have other oils and seeds which are on par, but I think during inflammatory stage and high risk stage, or if a child is on a higher BMI and quite of an inflammatory stage and is a type 1 diabetic child or something, I think therapeutic doses of fish oils and vitamin C are important, because this is not the time to test and try, but it is the time to protect. So, a few of the micronutrients, it's more beneficial to work on a therapeutic way. Zinc plays a very important role in all the immune cells, and it has antiviral properties. And by increasing the cellular zinc, we can actually stop the replication of RNA viruses, especially COVID. And loss of smell and insomnia and dysgeusia are because of zinc deficiency. That's what they found. And because the taste, the smell, they're dependent on particular enzymes which incorporate zinc. So I've just mentioned those enzymes here, so that we can study further, like how much of zinc plays an important role. Suppose a child is not eating and doesn't have hunger. Suppose you supplement zinc, the taste improves, the digestion improves. So instead of going for digestive enzymes, so we can go for a zinc therapy first to see how it works, and once the taste and smells are all good, that should be better. Exercise has also been found very, very important to prevent inflammation in the body. So they have recommended an exercise schedule also for COVID, pre-COVID and COVID and recovery of COVID also, and the most important thing is they asked us not to do extensive exercises, because intense exercises or weights, kind of gymming and high intensity exercises spike up your insulin and spike up your cortisol, and they are very inflammatory. So they said moderate aerobic exercises 30 minutes a day, and you can split it into 15 and 15 minutes too. And normal household work for 15 minutes is considered as flexibility exercise, and 15 minutes of squats, or they said around 20 minutes or 30 minutes of moderate intense exercise 3 times a week is fine. So when you're deciding about an exercise for a child, 30 minutes of exercise, because of the COVID days, children are getting up late. Most of my children that I see in the clinic, they are getting up at 8 because the classes are starting at 9. So they're morning missing their exercise. And unfortunately, they're putting up their play activity before bedtime, that is around 7 to 8 o'clock in the evening, and then they're having dinners. I think that's wrong, because getting up late in the morning itself, your insulin rise starts at 7 in the morning, and you're getting up at 8. That would mean your sugars are really low when you get up, because you are fasting for quite some time. And if you're going to play in the evening and then have your dinner, that means your hunger is high, and you're going to increase your carb load in the dinner, and then your sugars may be very high before bedtime. So trying to put your exercise before your major meals is not advised. Try to put your exercise between major meals is advised. And trying to distribute your exercise activity for children, 15 and 15 minutes is better than 30 minutes at a go. And normal walking at home, and 3 times kind of body weight exercises should be advised, or a good play, but trying to maintain the COVID protection guidelines. So coming to potassium is a kind of electrolyte which has found its way mostly being COVID, and also in diabetic ketoacidosis, because we have a huge amount of hypokalemia here because of the viral infection, and the potassium is actually intracellular. So with a lot of cytokine storm and cell destruction and loss of muscle, so there's a lot of change in their potassium levels here. So generally hypokalemia has to be addressed. So a high potassium diet is advised, but here a high potassium low carbohydrate diet is advised. So most of the fruits which have high sugars and potassium are not given here. So we need to pay attention to a carbohydrate free based potassium support here. So the nutrients which were important for COVID-19 and diabetes type 1, D plays an important role, A, and zinc, vitamin C, fish oil, and a high potassium diet. The calories which were decided for a high BMI is 20 to 25, and for an underweight could be 20 to 25 to 30 calories per kg depending upon the sugars. Protein was decided at 0.8 to 1 gram per kg. Carbohydrates 50 to 60% complex carbohydrates. Fats, healthy fats 15 grams a day. And diabetic meal plate, we followed half a plate of vegetable, the whole plate, half a plate of vegetable, 1/4 of protein, and 1/4 of complex grains. But 1/4 of plate protein would be mostly plant-based protein. That's what is the COVID-19 guidelines, and egg whites are allowed, and fish is allowed. So the new onset of diabetes was 80% in NHS study in UK. So that was quite, bigger number that than expected. We found 3 to 5% in our hospitals, but globally it was 80% increase in new onset diabetes. That means once the virus invades the body and the lungs, because there are good binding sites in the pancreas too, that could result in, or the virus per se could destroy, or the cytokine storm could destroy the pancreatic cells producing insulin. So we generally thought it was a transient diabetes, and we did discharge them on insulin, but when they came back after the recovery and 2 weeks, we still found that the sugar levels were high, and we tried to taper down the insulin levels, but we understood that it's a type 1 diabetes and not a transient diabetes. So it's slowly understood that the diabetes which sets in during COVID-19 could be a child closer to a type 1 diabetes and could have been magnified into a permanent type 1 diabetes because of the COVID-19 insult, or the insult could be so severe that the child had to be on type 1 diabetes. But most of the children that we have seen in the hospital are not with a high BMI, and they had very poor eating habits. And one of the child, I found it very difficult to really do it, because the child was only eating tea and biscuits in the morning, and was just eating rice and 1 spoon of dal for lunch, and dinner was just milk and rotis. And probably there was no protein in the diet, and the child refused so much in the ICU. And when we tried new food to him, we had a lot of diarrhea and things like that. So it was quite difficult, to get a child with not inappropriate eating habits, and then trying to deal with COVID, and then trying to bring the child to normal glycemic levels. So high rates of diabetic ketoacidosis was observed because, the less of insulin there and the high sugars there, and the body sets to use high fat stores for the energy metabolism. So that's when we have a lot of ketones, and diabetic ketoacidosis was one of the major reasons they got admitted. And then they were positive, and they were then had to be treated, and then that's how they found themselves as new onset type 1 diabetes. So to sum up, I would say based on the U curve of the BMIs, pediatric weight maintenance is very, very important. Not only looking at the child on the growth charts, but I think, trying to understand the BMI is very important, because we just say they're underweight or, they're malnourished, but we don't categorize them in the BMI. So once we categorize them in BMI, suppose we find them at 15 or 16 kgs per meter square, we are more sensitive to the numbers of the BMI rather than underweight. So, I think we need to see the BMIs also. And all the underweight children should also have the glucose levels monitored, maybe even the insulin levels monitored, so that we understand where exactly they're hanging on. Glycemic control is important, and postprandial is very important, and fasting is also important, but most predominantly postprandial, so that it's in our hands to change the diet so that the postprandial sugars are better controlled. Optimal diet, because child's diet is very different from the adult diet. They have food preferences, their food likes and dislikes, and the school timings, and they have to have the breakfast by 8 o'clock, and they're sitting in the class for next 4-5 hours without any activity, and they have the lunch and they're sitting in for the class for another 3 hours before the computer. So how do you plan your diet and trying to maintain the glycemic levels and trying to see that your child is not obese? It's one of the most important thing that the anthropometry and the activity pattern and the likes and dislikes of the child will decide about what optimal diet you can write for the child. And try working on your adequate dietary iron and the micronutrients. And this season, predominantly, you need to work on your fat-soluble vitamins, ADE, and then you're going to work on your vitamin C, and you're going to work on your zinc also. So, whether you're going to work on a therapeutic way or you're going to work on the dietary also is very important. But if you're working on a therapeutic way, that means you're trying to give a multivitamin support to a child, hunger increases and they want to eat more. So, and the absorption of the therapeutic food is also, therapeutic doses of multivitamins along with food is another concern. So you need to work on how much of therapeutic you would do. You can do thrice a week too, or maybe 4 times a week, and not regularly. But definitely don't go for chewies, anything which has sugar content in it. And work around the exercise pattern for a child and try to put the exercise in between the major meals and split up the exercises, and do not allow your child to do treadmills and adult exercise activities, because those are high intensity exercises. They're again inflammatory for a child. So try and do not push a child to do the exercise beyond their capacities, because again, they're tired and fatigued, and they're kind of wanting to eat more, or they're more lethargic. So minimum exercise to their limit is more important. And sleep plays a very important role during the school timings. I think they sleep well, but during the COVID timings, the sleep patterns are extremely different, and that's where children have to be educated about their sleep and the wake up and their exercises, so that they handle their health much better. So thank you. Can ask me any questions now?
Yes. Any
Yeah.
questions I will read out from the chat box.
Good.
Okay.
Brindavani, it is such an alarming.
Yeah, thank you so much, Dr. Brindavani, for the wonderful, detailed insights of each and
Thank
every
you.
nutrient you have taken, from macronutrient, micronutrient, and everything you have covered. As usual, so this will be the fantastic presentation, and
Thank you.
available all advice is, even the preventions by various measures, how to avoid the stress. You have given everything. So the really wonderful presentation. It's useful for everyone, I believe it.
Thank you.
I think it's very less questions. It has come to the box. Can anyone read the question?
Yes. Anjali is asking glutathione and melatonin. What
Funny,
supplements?
your voice is low. Sorry to interrupt you,
Yeah,
but your voice is low.
Now is it okay?
Yeah, better.
Yeah, glutathione and melatonin. What supplements are advisable?
See, glutathione and melatonin, glutathione has an inverse relationship with insulin. So whenever you do a glutathione and support your insulin, these things have, inverse relationships, both glutathione and melatonin. So unless until you really need it, I don't advise.
Okay.
No, I don't advise, because anything which has an inverse relationship with insulin is something that is not to be advised, taken, because glutathione now is being taken as a skin glowing supplement, and a lot of supports are there. I think that's not right unless until it's therapeutically recommended. Yeah.
Okay. Another Syed Munibuddin asks, you've spoken something about the relation between mixing of dark colored with meal to bloating. Could you please speak on that once more?
Okay, new research has come up with, unfortunately, we genetically predispose the brush border differences, not to identify deep colored pigments in the intestine. So suppose, somebody takes a raw carrot, maybe they can tolerate a grated carrot, but not a bite-sized carrot, somebody who could chew it. So immediately, they bloat, and it's not digested, and they constipate on it because it's not absorbed. So anybody who develop rash with pigments, children, when we feed them any deep colored carrot or beetroot puree or grapes, we see a lot of rash on the face. That would mean they are pigment allergy. So that means it would be resolved. So generally, I do tell them to put the pigmented food with a carbohydrate like sweet potato or a potato, because once the potato is being digested, the pigments are, kind of their allergicity or their inacceptability is minimized. So, but if you're trying to do pigment allergy child with carrot milkshake, I just immediately gives them a diarrhea.
Okay. But that was such an alarming situation, Brinda. 80% of increase, and the way you were putting out the facts and all, really alarming. And
Yeah.
and there are more of compliments given to, thanks to all dignitaries for the amazing session and educative session, informative. Yeah.
I have
Ananthan sir?
I have one small question, Brenda.
Yeah.
I found some people taking melatonin for a jet lag. What are your comments on that? Out of the context.
See, melatonin. Generally we give for neurological children who don't follow wake and sleep cycles, and we give them to our epileptic children. But epileptic children do sleep, but what happens? They sleep in the morning, they don't sleep in the night. Or maybe a child is there in ICU for 2 weeks together and forgot the rhythm of day and night. That's when we give. It is available, the drug is available medically, it's available, but it's not needed, because sleep is something that you can train the body. So somebody who has a sleeping issue, could be a baby or a child, what I tell them is, suppose your baby is not sleeping in the night and crying all the time. So you feed the baby by 7 in the evening, try to do a hot towel for the baby, kind of rinse them, not a bath, but then, hot towel cleaning, and then massage them, and then put them into dark light or dark room, and then make them go to sleep, because it's a habit that can be trained. So biologically, we have an inborn circadian rhythm that has to be restored. That cannot be managed with a medicine, because your internal sleep cycle doesn't come in. Suppose I'm taking a sleep medicine to sleep, that means I'm sleeping, but physiologically my body hasn't gone into the deep resting phase, wherein because insulin and growth hormone are inversely related. So when insulin and growth cortisol are high, your growth hormone is low. So when your insulin and cortisol are low, your growth hormone is high. So that's where is the circadian rhythm. So once the growth hormone is high, that's when your internal female hormones or the entire hormone profile is set in. So trying to take something to nurture a sleep actually is not, won't benefit you much.
Thank you.
I have a small couple of questions. It's a general question. During this lockdown period, it's very difficult to send the children outside for the physical activity. Not only me, I have seen many of friends as well as the neighbors. Do you have any advice for them, how to make them to active, sending them to for free? Do you have any special advice for these kind of people?
Yeah. So there are growing tall exercise modules for children. So growing tall exercise modules is trying to mimic your growth hormone pulsating system, because constantly sitting at home and not interacting with friends, and kind of cloned in their own kind of stagnated life for them. So growing tall exercises are you need to do 20 repeats of 10 minutes fast exercise. Either you can spot jog fast or run fast for 10 seconds and walk for 10 seconds, and run for 10 seconds and walk for 10 seconds. So what happens is you have a growth hormone pulsating system which increases the rhythm in the body. That actually makes the child more happy, more energetic, because internally you have triggered their hormone metabolism. See, forcing a child do this, do that, physically he will do it, but the trigger of the hormone is actually more beneficial than physically doing anything. So I always believe in doing things which hormonally correct them, so that hormone itself promotes them to be more happy, coming down on their aggression, and trying to be active, being wanting to do more. That means if your hormones are right, your horse is right. So growing tall exercises are very beneficial. So if you have a stationary cycle too at home, you can cycle 10 seconds fast, and then just 10 seconds slow pedal, and then 10 seconds fast and 10 seconds slow, and twice you do. And if you want your child to grow taller, you need to do this exercise before the bed, around 30-40 minutes before. So it actually helps the night hormone, so that's beneficial. So I generally told my COVID children to be active this way.
Thank you. And then a small question, because of this lockdown, so most of the lowest socioeconomic population, they are in the status of food insecurity. So most of the nutrients. So do you have advice? Is there any alternative way to reach out there the nutrients?
See, actually, their diet is the best diet everybody could follow. So, suppose if they're having, I have a cup measure. Okay, you can have a cup measure. So, if they can have boiled chickpeas in the morning, a cup of it, then try to have a small breakfast and a glass of thick buttermilk, or a small breakfast with some curd or with some ragi. So we are trying to cut down the grain here, and we are trying to give a low GI grain there. So, and then trying to put a chickpea there, and trying to eat some boiled vegetables, or, fresh vegetables in the lunchtime, I mean, midday, and then lunch would follow their habitual rice and dal. But if they can add some sprouts in their sambar, try to incorporate 3 times beans for their diet. So starting in the morning, some bean and sprouts in the sambar, even if they're not able to buy vegetables, and some vegetables and a little bit of fruit in the 10 o'clock, and evening. But I think earlier it was like they're not able to afford milk, but I think they're able to afford milk. So if they can work around milk with a grain again there, maybe a ragi and milk together, or any other high iron grain with the milk, and then go with the dinner, and try using curry leaf powder for their iron, because every day for them to buy palak and cook is very difficult. So if they can make curry leaf powder, and they can add 2 big tablespoons, that will help them. And maybe deep colored vegetables, and if they can pickle carrots or beetroot, so at least because they can store it for some time. So the deep colored vegetables can go, not using the oil and all, but at least the vegetable can be saved if it's pickled. So that can be added with, and then curry leaf powder and rice and chickpeas and moongs, we can manage. But if they depend only on tur dal for their protein, it's going to be difficult. because tur dal, the protein content from the tur dal with their rice cannot be matched. Yeah, and peanut.
Okay, thank you so much. Thank you so much. Good.
Any
So,
other questions?
yeah, any other questions?
I think we are done with the questions, Fanny.
Yeah, I
Let's
think
go
we are
ahead.
done with the questions. That was indeed an enlightening session, ma'am. It has provided us with information that stimulates thought and discussion and a curiosity to know more, learn more, and do more. Thank you once again, ma'am.
Thank you. Thank you all.
Yeah. I now request Mr. Kunj Bihari, sir, Dr. Ananthan, Dr. Ashwin Dabi, Dr. Brindavani, and Dr. Janaki to accept the memento as a token of gratitude. Of course, a virtual, but a real token of gratitude.
Thank you.
We'll be sending across these pics to you, ma'am and sir.
Okay.
Thank you. Good.
Yeah. May I now request Mayuri to make an IPAN announcement? Mrs. Mayuri started True Diet in the year 2016 after working with several health and wellness organizations. She was featured in numerous nutrition awareness campaigns of several print media of Telangana. She has provided diet care services to several notable film and TV personalities, also conducted wellness programs for various clients like Infosys, etc. Currently, she's also co-hosting an online webinar series along with Janki ma'am, as we all know, the Tuesday Tea Talks. Over to you, Mayuri.
Thank you, Fanny. Thank you for the introduction. I would not take not more than 5 minutes. I would like to share this screen with you all.
Yes.
This is about the IPAN. So IPAN Hyderabad chapter. So a small intro about IPAN. IPAN, the Indian Association of Parenteral and Enteral Nutrition, is an organization in the field of parenteral and enteral nutrition, which promotes the basic research, clinical research, advanced research, and advanced education about clinical care and the quality control. IPAN was registered under the Section 8, which is a non-profit organization of the Companies Act in the year 2013 by Government of India. The aim of the IPAN is to improve the nutritional care of people at risk of malnutrition, whether in hospitals or in the community, and to promote basic clinical care and care quality control. So every year, second week of the February is being celebrated as IPAN Malnutrition Week, where malnutrition awareness programs are being conducted by different chapters of India. IPAN is collaborated with various PEN organizations, as said by Fanny before starting of the meeting. So IPAN is recognized by European Society of Parenteral Enteral Nutrition, American Society, British American Society of Parenteral Enteral, and all the sister PEN organizations. Indian Association of Parenteral and Enteral Nutrition is being started in India in the August 2012 by R.R. Sivakaran sir, along with 10 distinguished founder members, and has been running successfully till date. And the current officers are our honorary president is Dr. C.S. Chamania sir, and honorary vice president is Dr. Ashwin Dabi sir, who has just presented his talk, and the honorary secretary is Dr. Shilpa Verma. And IPAN Hyderabad chapter was launched on World Heart Day, that is on 29 September 2020. On this auspicious occasion, we Hyderabad chapter members released an awareness video on heart health, and which was done on the launch day. And coming to the lifelong learning lessons about the IPAN. IPAN offers lifelong learning courses, which is an initiative which provides stimulating, congenial, and varied opportunities designed specifically for lifelong learners. in advanced clinical nutrition care. And IPAN is a multidisciplinary society where doctors, it's not just for nutritionists and dietitians, where other medical professionals like doctors, academicians, nursings, and all the pharmacists can come together and work for the medical field. They also form the members of the society. So coming to the IPAN membership is worldwide and is open to applicants who can demonstrate a genuine interest in the science of human nutrition and support the society with the aim of to improve the nutritional care of people at the risk of malnutrition and food adulteration, whether in hospitals or in the community, and to improve the basic and advanced clinical research and to organize the consensus statements about clinical care and care quality control. IPAN membership brings many fiscal benefits, resources, and discounts together with the opportunity to join this dynamic multidisciplinary network. Coming to the benefits, benefits for the membership, people who have all the registered members get the scientific updates from all the pen associations, not just the IPAN, from all the other pen associations also. And as it helps in the development of medical team culture, as the members are not just from the nutrition, but they are also from the other healthcare fraternity too. And it also provides the insights of, it also gives you an insight e-magazine, where you can also, where members can also publish their studies and articles, the lateral development due to the varied networking, and can enroll in IPAN certification courses and become expert in a chosen field. Coming to the IPAN Hyderabad, IPAN Hyderabad, the honorary president is Dr. Kunj Bihari sir, and the vice president is Meena Patange ma'am, and our honorary secretary is Dr. Janaki. This is being run by these dignitaries. And coming to the membership, Chitkala Ranjan is our treasurer, who will be taking care of the membership, and account details are being there, and the membership fee is 1,000 rupees. All these details will be sent to the register members through an email. You can just reach out to us with any queries. You can just reach out on our email ID iapenhyderabad@gmail.com. And with this, I would like to conclude my session. Over to you, Fanny.
Yeah, thank you, Mayuri.
Yeah, one second.
I think many of our students are also awaiting to take membership.
Yeah.
So yeah, we will.
The feedback link and the membership details will be emailed to all the registered members.
Okay, I think they would have made a note of it. And now, yeah, thanks, Maidi, once again. And now about Dr. Janki. Janki ma'am, yes, doesn't need an introduction, our own very lovable and Tuesday Tea Talks ma'am. But me being the MC of this webinar, I wouldn't miss this opportunity to introduce ma'am. Dr. Janaki is the founder, owner, and consultant of Dieta. Ma'am's mission being to provide diet and nutritional inputs and lifestyle management in pursuit of healthcare. Ma'am always strives for professional excellence. And ma'am is a practicing nutritionist, pioneered several landmark programs in the field of nutrition, contributed several articles on diet and nutrition in various newspapers. Dr. Janaki also served as Vice President of Indian Dietetic Association, TS. Currently, as we all know, ma'am is hosting an online webinar series, Tuesdays Tea Talks, which is a big hit, a unique initiative featuring experts from the nutrition and diet care talk on the trending topics of healthcare. I would like to request Dr. Janaki Badgu ma'am, Secretary, IPAN Hyderabad chapter, to give the closing remarks.
Thank you, Fanny. That was the whole session is really awesome, and we went way beyond our time. But still, people stayed back and listened to every information that our speakers presented, and they really asked quite good number of questions. And I never knew that a person who's giving vote of thanks would be introduced in such a lovely way. Thank you, Fanny, for that. And vote of thanks is a very, very pleasant job, because at the end of the day, finally, we'll be closing our session. So for organizing team, I think it is the best time for them. So jokes apart, First of all, great appreciation goes to both the speakers, Dr. Ashwin Dabi and Dr. Brindavani, for taking their precious time to present their knowledge and experience on this platform. And we immensely thank Chairperson Dr. Anandan for so eminently conducting the session. So thank you so much for coming. In fact, you had a IDA meeting. 3 to 4 was your IDA meeting, I suppose, and you just came on time for us. And a huge thanks goes to organizing secretary to the of this program, Dr. Meena, and her lovely and sweet team of St. Anne's College, faculty YB Fanikumari and Miss Nasrin Begum, and students Chaitanya, Sri Nitya, Monica, Sanjana, Sahina, and Naureen. And special thanks and hugs go to Mayuri for putting up all the glitches we faced in the initiation of this program. And finally, we succeeded. Thanks a lot, Mayuri. I'm sure it must have been really a tensed moment for you when we first seminar of IAPN and we were just at the nick of the moment. Thanks a lot for putting up with that. Then great applause to our stalwart and pillar strength, our president IAPN, Kunju Bihari sir. And lots of appreciation goes to audience for their presence and their patience and continued encouragement for whatever we do. They are there for us, continuously encouraging us, and also posing questions and stimulating us to do more and better programs in the future. Thank you so much. Kani.
Bhimrao sir has posted in the chat box. Thanks for the organizers. I am suffering with fever and cough with coryza. I could not participate actively. Sir, it's absolutely fine, and thank you so much for your presence. It made our day really. As we come to the end of the session, before we wrap up the webinar,
could you please ask Bhimrao sir to unmute? I guess he would like to share some.
I think sir is not able to unmute. I mean, because he was suffering with cough.
Okay.
So that's what sir has written, Mayuri.
Okay, go ahead.
Yeah.
But he was looking fresh and nice, and he gave such a lovely speech.
Yes,
No. Being I was being a bit of this one. I'm very sorry that actually I want to participate more actively today and put to some of my own personal views with you. But I'm very happy that the proceedings I was listening. It's a very great session. And the first session with the first IAPN meeting is a very good successful this one, and the oratorship and the presenters are so vast experienced and very much been useful for the students and professional colleagues of us. And thank you very much for all the people, and particularly Janaki, Mayuri, the efforts they are taking for the conducting these meetings are really appreciable. And the colleagues all are requested to come back to us, and we will create a great platform soon, and I will be free from the obligations. Now I resigned as a managing director of the company, and I was being free, and I am at your disposal all the time. Janaki can use my services at any level, which if required, I can come back to Hyderabad, and I will see that it goes on well. Thank you very much. Thank you very much. Thank you very much to all the audience and the speakers. Thank you very much.
Thank you, sir. Thank you so much. Yeah, before we wrap up the webinar, I request everyone to rise up for national anthem. Thank you
Jai
all.
Hind. Thank you.
As Mayuri said, the feedback link and IPEN membership details will be forwarded to your mail. Thank you.
Thank you so much. Thank you
Thank you.
once
Thank you,
again,
everyone.
all the lovely team.
Bye.
Thank you. Thank you
Thank you.
Bye,
Thank you,
everyone.
Janki. Bye, everyone.
for your patience, especially so much with so much patience. You all of you have stayed by. Thank you so much.
Thank you, ma'am.